The airQ device comes in two versions. It comes in the disposable version and also a reusable version. The airQs come in 6 sizes, from size 4.5 to size 1.0. The 1.0 is for kids, usually newborn kids, from about 7 kilos down to about 4 kilos. The size 4.5 is the large adult size. Now, what I'd like to do now is to show you what I believe is the easiest way to insert and inflate the airQ. Now, there's lots of ways to do this, but I think that if you use this technique, at least I believe you'll be successful. Before I do that, I'd like to show you the wrong way to do it. And unfortunately, it happens to be the standard classic technique used by LMA that some of you have been taught. Basically what that is you put the index finger along the back of the cuff, you place the airQ along the back side of the hard palate, and you basically push and force the airQ or the laryngeal mask around the corner into the pharynx. Unfortunately with airQ, because the angles are different, it's built more on inline than versus an angle. If you do that, push it on the hard palate, you'll turn the airQ like this. It'll be a very difficult placement, it'll be traumatic, and you won't be able to ventilate very well. So if you're a person that puts airQs in like this, or laryngeal masks like this, I think it's important that you use a different technique. Now, the fortunate part about this is the other half of you out there are insert LMAs like I do, and I call you finger flickers or shoehorn guys. Basically, you put the airQ in on a forward angle, and if it gets stuck, you use your finger somehow. I like to use my finger with the knuckles toward the feet behind the mask, and use your finger as sort of a shoehorn or help so that you can guide the airQ and the laryngeal mask around the corner, and once it's around the corner, it'll slide in quite easily. So those of you that use this technique, you're going to find it very easy to place airQ. People who have used this technique on a regular basis, you're going to need to learn how to change the angle and the way you use your finger to help the airway around the corner. Now let me show you how that works. First thing I'm going to do is lubricate the airQ. Usually I put some lubrication on the back of the device, and I lubricate the entire back and sometimes just this part of the tube. Then I roll my finger around the cuff of the device, and I lubricate these 3 little ridges, but I leave that center section alone because that's the breathing pocket of the airway. I always put the head in extension if possible. I use a tongue depressor to lift the tongue, and I place the airQ in on a forward angle if I can, at the base of the tongue and the junction of the tongue and the soft palate, not the hard palate. Once I get it in there, I usually put my finger up on the cap, I wiggle it around, and I just slide it around the corner. Now, I'm going to take this out and show you one more time. I lift the tongue up, I slide it around the corner. Now, if I have a very large patient, once the airQ gets around the corner, I usually stop and drop the tongue depressor. I reach in and do a mandibular lift. I lift the mandible, and then I finish the placement of the airQ off, pushing mostly with my index finger on the connector of the airQ and supporting the airQ tube with the remainder of my fingers. Now you can do any kind of version of that. The important part is put the airQ in on a forward angle, put the patient in extension if possible to give yourself a little more room, and use your finger as a helper or a shoehorn to help it get around the corner. Once you get around the corner, it should slide right into place.